Greetings, friends, and welcome to our February Educate and Empower webinar, Yoga for Stronger Bones, Caring for Osteoporosis. My name is Michelle Postek, or Shelley, IWMF Director of Information and Support, so it's nice to have all of you join us today. Today we'll be learning about this topic, doing some gentle yoga, and at the end, we'll have a short question and answer period. Please keep your questions to the topic of yoga and exercise and steer clear of questions about medications. You can type your questions into the chat along the way. Please remain muted during the entire program, as we will be recording for those unable to join us live. Now, I am delighted to introduce our speaker and my colleague. Anne Grace McMullen is a certified yoga therapist who specializes in tailoring the practice of yoga and especially enjoys providing tools to support the aging process. She is certified to teach yoga for osteoporosis through Dr. Loren Fishman and was featured in the New York Times article, "You're Never Too Old for Yoga." Since 2021, Anne has collaborated with the IWMF to create the WM Wellness Community, featuring a range of group classes on Zoom to address common side effects of WM and WM treatments. Anne hopes that through her yogic offerings, she can help those affected by Waldenstrom's take control of their own wellness journeys. So it's my pleasure to hand it over to Anne.
Thank you so much, Shelley. And I'm just going to say a really big thank you to you for being supportive of the wellness program and making this happen. And for all of you who either participate in the wellness program or have written in with your suggestions for things that we should be doing, this is all as a result of your interest in learning and growing and evolving. So I'm so pleased to present this topic that is kind of near and dear to my heart, and is, the reason behind me becoming a yoga therapist has to do with osteoporosis. So I can't wait to share a little bit more with you about that. I have a slideshow I'm going to present to you, and I'll move pretty quickly through that because I do want to get to the practice portion where we're really going to learn, what are the principles behind strengthening bone while doing yoga, and it's not rocket science. So we'll get to that. Please feel free to, move about as you need, stretch as you need. We're not really designed to sit and look at a screen all day. So with that in mind, I want to start off with a little exercise. Let's rub the hands together. And if you're wearing glasses, you could take the glasses off. I'm just going to cup my palms loosely over my eyes and take a few easy breaths away from the stimulus of the screen. Allowing myself to arrive in whatever state of being I'm in. Maybe I could roll my eyes around in my eye sockets and draw some energy up from the earth, a nice tall spine. And then gradually I'll just release my hands down and put my glasses on and get ready to take in some information. I suggest that for a webinar like the ones that we are hosting through the IWMF, you just let it wash over you rather than trying to remember everything and really pay super close attention. Just let it wash over you, and the things that stand out are going to be the things that stand out. You'll have a recording of this you can come back to, and I'll share my slides. And then, of course, we're going to be offering 2 practice videos that will be on our YouTube website that you can do on your own anytime. So I'm really excited. That's what I did yesterday. I made 2 videos for you. So let's go ahead and get started. I have 45 people here live and lots of folks hopefully watching this recording. I'm going to share my screen. Yoga for stronger bones, caring for osteoporosis. Here I am in my bone suit, which was so cool to put on and watch myself doing yoga so I could imagine how the yoga poses would add pressure to the bone and stimulate new bone growth. So that's why I'm wearing it. It's not some kind of weird stunt. I wanted to learn. So there's a lot we're going to cover today. I'm not going to go through this whole list, but it's basically, what we're here to do is learn what it is, who's at risk, how cancer factors into that, what are some lifestyle modifications we can make, understanding a little bit more about how new bone is formed, and what is the deal with weight bearing poses and non weight bearing poses. Can we still strengthen bone going beyond weight bearing? And I think you're going to find the answer is yes. We're going to look at what are the principles, what to avoid, and then we're going to practice the yoga sequence designed for those with osteoporosis or osteopenia and Waldenstrom's. And then we'll move into a question and answer period. And I put hopefully because I hope I can answer the question for you. So this is my student, Judy. She's 73 years young, and she is the whole reason I got onto this odyssey of trying to find the answer to the question, why did her bone mineral density score improve? Was it the yoga? She's a fixture in my community classes. She started regularly coming to my classes in 2017. And one day she showed up and she was so excited and she had her DEXA scan results in her hand. And she said, I can't believe this. I moved out of the osteoporosis category into the osteopenia category. And the only change she had made was a consistent yoga practice. So she asked me, could it be the yoga? And then I went online. I said, you know what, Judy, I don't know. I'm going to find out. So I found this study that was titled 12-Minute Daily Yoga Regimen Reverses Osteoporotic Bone Loss. And this is Dr. Loren Fishman, one of the authors of this study. And this study was so awesome. I have to tell you, it was a 10-year study of folks who were recruited and their bone mineral density scores were compared pre and post yoga. The yoga they did was 12 different postures, held for 30 seconds each on each side, and practiced on a almost daily basis. And the findings of the 227 people who stuck with it showed improved bone density. That means they reversed their bone loss. So, wow, Dr. Fishman is amazing. And these were the poses they chose for the study, those that were shown to stimulate bone growth in all those targeted areas of bone loss. And, I just want to point out there are a lot of other poses that help strengthen bone, but these are the ones that Dr. Fishman chose for his study. So you can see lots of poses that look like they might be kind of hard, right? Don't worry, we're going to modify them. And we can also try for the classic poses as well. But for this specialty population, I want to make sure we're practicing holistically, and we're only doing a few of the poses at a time so that we can address issues such as fatigue. Here I am with Dr. Fishman. He wrote the book, Yoga for Osteoporosis, and I completed his training in 2019. And I was able to go back to Judy and say, you know what, Judy, the answer is yes. It was the yoga. Keep doing it. So today I want to share a little bit about what I learned from him directly and how I have adapted his training over the course of this last 5 years and how it might relate to this specialty population. That's you with Waldenstrom's, who I've worked with since 2021. All right, take a breath. We're going into some science. What is it? I love knowing what the Latin roots of words are. So osteoporosis means porous bone. And you can look at this photograph or this mock-up of the inside of a bone and see that the honeycomb-like structure is a lot more open. So it's more porous, and that can lead to bone fragility, this loss of bone mass, and make us increase susceptibility to fractures, especially of the hip, the spine, and the wrist. And this is no joke, my friends. We hear a lot about hip fractures being problematic, and many of us have broken bones. But to hear these statistics that more than 200 million people suffer from osteoporosis worldwide, and that 1 in 3 women and 1 in 5 men over the age of 50 will experience fractures in their lifetime as a result of osteoporosis, it's kind of mind boggling. And I want to make sure that men realize they are also at risk. Sometimes we think of osteoporosis as a women's disease. So, men over 50 are more likely to suffer from a hip fracture than prostate cancer. So, we want to really be careful here with the hip fracture because not designed to scare you, but the mortality rate within the first year of a hip fracture is 21% over the age of 50. So, serious business. Many of you answered the question on your registration page that you do have osteoporosis or osteopenia, so you must have had a DEXA scan. This is the established standard for measuring bone mineral density. And it's the only test that can diagnose osteoporosis before a broken bone occurs. So it's pretty important to do this test after a certain age, or whether if you fall into one of the risk categories, which we'll go over in a moment. So this DEXA scan is measuring your density, bone mineral density in your femur neck, in the hip, and the lumbar spine, and comparing it to a healthy 30-year-old's bone mineral density. So I think it's kind of cool to know. I wish I had known this when I was in my late 20s, that I would reach my peak bone density then. I would have done all of the bone strengthening things I could have thought of. But anyway, it's not too late to maintain what I have and maybe even reverse it. So maintaining this continuous process that's called remodeling. Old bone is removed, new bone is created. So one of these processes builds up the mass and the other eats the substance away. And there are certain factors that can contribute to bone thinning to such a degree that we might develop osteopenia. It's things like age, genetics, lack of exercise, poor diet, and cancer is one of them. But before we go down that road, I think that it's important when we get these DEXA scan results, they can be a little bit confusing. So they show the T score, and that's again the difference between your BMD and zero. Zero is that healthy young adult, and we're comparing yours against theirs. So you might be, say, I'm at a negative 1.5, then I would be in the osteopenia category. The lower your T score, the higher your risk of bone fracture. So Judy, our patient, our student at the very beginning, she was in the osteoporosis category in her femur neck. She was like a 2.6 or something, and then she moved to like a 2.0 from her yoga practice. Common risks. You're older than 60. Maybe you've broken a bone later in life. You might be underweight. You might have a stooped over posture, and as a result, height loss. And posture is something we can work on with yoga. So don't fret about that. I'll give you tools today to work with that if that's you. And you might have had a hip fracture or osteoporosis in one of your parents. So, according to the International Osteoporosis Foundation, there are certain disorders linked to osteoporosis. I'm not going to read all of these, but it's here for you to look at. And, I've circled prostate or breast cancer because many of those with Waldenstrom's have additional cancers. And cancer is sort of the topic that we're on today. but you might have some of those other things going on. We know that the cancer patients are at an increased risk of bone mineral density loss following the disease and its therapy. The rate of osteoporosis is elevated, and that's independent of sex or cancer type. But what about Waldenstrom's? And I'm just going to have to say there just isn't enough research out there. I could only really find this one single case report um, that describes a man with vertebral compression fractures. And that suggested there could be a link between Waldenstrom's and bone fragility. And I know a lot of you, and including my father, who's diagnosed with Waldenstrom's, do have thoracic spine vertebral compression fractures. And who knows if it's as a result of Waldenstrom's. The drugs we take can make us more susceptible to osteoporosis. And I've circled steroids here because many of us have to take steroids. Prednisone is one of those. So if we're using that for 3 months or longer, we're at a higher risk. And again, I'm not a doctor. I am not trained in medical anything. So this is something, if you are curious about, you want to talk to your doctor. Um, I did research briefly what some of the Waldenstrom's treatment drugs do. And actually, some of them show an improvement in the bone mineral density, like rituximab. Ibrutinib said that it might play a role in bone damage, but there really, again, is not enough research. And when you look deeply at the studies, there are things that are flawed with the studies. So, we're just beginning to understand all of this. And again, please talk to your doctors about this if you have questions about the effects that your medical conditions and medications might have on your bones. Here is what we can do to change our risk factors. We can make lifestyle modifications. We can make sure we're getting enough calcium. We can spend time out in the sun. We can get up and be more active. We can avoid alcohol and avoid smoking. And here's Dr. Fishman again. I pulled this directly from his book. He wants you to eat a diet adequate in protein and calcium and lots of veggies. He wants you to get out in the sunshine and or take that vitamin D supplement. And I've highlighted this: get adequate exercise of the right variety, because that is what I can help you with. Do develop good postural habits. I think maybe we all just sat up a little straighter when I read that. And, he talks about coffee and he talks about protein, and there's mixed research about that, but I wanted to share those as well. But the important piece to take away from this slide is that we need to give our body the tools of the minerals to produce bone. Because if we don't do that, you say I do all the bone strengthening yoga in the world, but I am low in vitamin D and I'm low in calcium. That would be like sending, a whole bunch of people to a work site without any tools. So I want to really emphasize that. Physical activity and exercise have been proven to be beneficial in the oncological setting and shown to be safe and feasible in patients with cancer suffering from bone mets and affected by osteoporosis or at risk of bone loss. And I put this up here because a lot of our doctors do not want us to exercise if we have cancer spread to the bones, because they're worried about safety. And that's a very good thing to be worried about if your bone is very fragile. But I want to just say that there's more research that shows that it is safe and it is feasible for us to find ways to be active and do bone strengthening without injuring ourselves. This is really cool. I love learning. And this is, when Dr. Fishman showed us this, my mind was blown. When we are born, you can see at the very left, the femur bone of this child is completely straight. And then this child learns how to walk. And over time, the femur neck becomes angled as a result of what's called Wolff's Law. And this Wolff's Law just says that you put pressure on a bone and it's going to remodel itself over time to become stronger and resist the loading. And the opposite is true, right? You don't use it, you will lose it. The bone will become lighter and weaker if you don't put pressure on it. So exercise has been shown to help with that without affecting the rate of bone removal. All right, little slide here for all you science geeks out there. Osteoblasts. These are the cells responsible for building bone. They turn into osteocytes, which are important cells as well. And then the osteoclasts release substances to break down bone so it can be removed. You've got these two things happening. We're building it and we're taking it away. Both are equally important, and we want to maintain that some sort of homeostasis. However, certain types of cancer can disrupt that production, like myeloma can invade bone tissue, inhibit osteoblasts, at the same time stimulating osteoclasts to increase cell breakdown. So homeostasis gets out of whack. This is my slide I created to get us really excited about exercising. This is my osteoblast. We're going to have a blast a little bit later, strengthening some bone by doing yoga. So, how many of you here, raise your hand, have gotten the prescription to do weight bearing and impact exercises for your osteopenia, osteoporosis? I bet it is almost all of you. That's the usual prescription. But people who are over the age of 55 might also have osteoarthritis. And impact exercise is exactly what the doctor did not order. However, yoga safely stresses bones without impact and ameliorates osteoarthritis. It puts more pressure on the bone than gravity does. And we're going to learn a little bit more about that in a moment. Putting that pressure by one group of muscles opposing the other can stimulate these osteoblasts, these bone making cells. And it's been shown to strengthen bones without any evidence of weakening the joints. So those are all good things about yoga. You can imagine going a little bit deeper into this idea of what are some things we can do to put pressure on bone. Muscular stimulus, right? So if we're weightlifting, we're putting stimulus on the bones through muscles. You can imagine this tennis player's right arm is stronger because he's using it. And then, looking at the astronaut who's in space without a lot of gravity or without gravity, is going to return to Earth with weaker bones. So there's been no muscles working to exert any load on the bones there. So if astronauts could only do yoga in space, they would probably be much better off. So we're getting into the yoga piece. This is Judy. And here she's showing a pose called Warrior Two, which is one of the poses in Dr. Fishman's study. And she's showing you what's greater than gravity. So you can imagine you can lift your arms up right now as I talk about this slide, if you are able to lift your arms up and keep them up. And you start to notice this load on the shoulders is greater than the load that it would be if your arms were just down by your sides, right? So putting mechanical leverage can put additional pressure on the bone to stimulate bone growth. Another thing that's greater than gravity, dynamic tension. And here you can see Judy is doing a pose, yes, one of the poses called big toe hold. And she's using a strap to pull the leg in towards the face, but she's also pushing the heel up into the strap. And this is one group of muscles opposing the action of the other. And this force is then greater than gravity. Forces on the bone is going to be doubled. So anytime you're doing any yoga pose, or anything for that matter, if you can engage the muscles And think about the play of opposites, expansion, contraction. So, getting into the principles for stronger bones here, we're going to be avoiding poses that round the spine. I'll talk more about that in a moment. We're going to be practicing safe and stable alignment, practicing right effort, and listening to your body. Those are the principles we can apply to any yoga pose, not just the poses in Dr. Fishman's study. So, a lot of us do need to be concerned about rounding the spine. Those who have osteoporosis, severe osteoporosis, could could really aggravate things by rounding the spine, and you're at a higher risk of compression fractures in the thoracic spine. And some of you in this group already do have them, and my dad is one of them. So, we're going to be working on altering the poses that we might do in yoga, like this forward fold. You can see this Paschimottanasana is the pose, and she, instead of rounding forward and just collapsing, she is really working towards lifting up and just taking a bow with the heart forward. So we're going to be working with posture, posture, posture. Safe and stable alignment. Here I am in my bone suit again, showing you two ways to do triangle pose, which is one of those poses. And you can see that I am using the chair for one and not using the chair for the other. And they're both doing the same thing. They're putting pressure on that femur neck in that left hip and right there in the thigh bone and the hip. You can see and you can imagine that the lumbar spine might also be um, getting a little bit of a bone push there. But with the stable alignment, Dr. Fishman comes from an Iyengar background, and they're very strict about their alignment. I'm taking this and I'm telling you, you're allowed to practice alignment that feels safe and stable for you, but might not look like what I look like or what Instagram looks like, because we're all different. So we're not going to force it. I really want to emphasize this, coming from a trauma informed and more invitational backgrounds. It's important that we find yoga that feels good to us. um, Notes about twisting. So here's another one of my students, Carol, and she is just a force of nature here. She came over one day, and because I really believe in showing real bodies doing the yoga, and here she is doing a twist pose where she's keeping her spine really tall and engaging her muscles authentically and twisting, which Dr. Fishman considers perfectly safe to do and a great way to put pressure on the bones in the spine. But I want to let you know that you can talk to your own wellness professionals about this, because you might get mixed messages about this. Um, so we're going to be practicing a twist today that we can do very gently and very safely. Right effort. This is probably one of the fundamental parts of practicing yoga for stronger bones. You can apply this to any yoga pose where you want to put pressure on the bone. So, the bone forming proteins seem to synthesize after 10 seconds of stimulating pressure. So, all poses should be held for at least that amount of time, 10 seconds. Dr. Fishman recommends holding the pose for 30 seconds, but because we're working with a population who might be caring for fatigue or balance issues, I say we could do it for about 12 seconds, and we'll probably still going to be getting the good effects of that. So I want you to just for a moment close your eyes, feel the feet on the earth. I'm going to start my stopwatch here. And I want you to count how many breaths it takes you to fill up 10 seconds of time, starting right now. How many breaths is 10 seconds for you? All right, that was 10 seconds. So for me, it was about 2 breaths. So you might shoot for between 2 and 3 breaths or whatever felt comfortable for you. That's what we're going to try to do for how we measure our time rather than looking at a stopwatch. And finally, we're going to be listening to our bodies. Really important. And if you've come to any of my classes, this is just going to be like, you've heard it a million times that we're going to go slowly. We're going to adapt the practice for however we are feeling that day. We're going to use our props. Today we have a strap we're going to be using. And we're going to remind ourselves that it's called a yoga practice because there is no perfect. All right. So I would like to go ahead and bring out Ms. Osteoblast. Now I'm going to stop sharing my screen. We're going to have a little bit of movement practice. So let's go ahead and just take a stretch and maybe go grab your water, go grab something you can use as a yoga strap. And I'm going to reset my screen here. And I'm going to move to a slightly farther away place here. Let's begin with the feet on the earth, the seat in the chair. And I'm away from the back of my chair a little bit. And I'm sitting up nice and tall. I'm going to allow my shoulders to relax. The hands are resting in the lap. And I'm just going to close my eyes or soften my gaze down and take a moment to allow myself to arrive. I might notice the breath coming in and out and taking a few easy breaths, giving myself permission to take really good care of myself throughout the rest of this session. And I'm not going to push through pain or discomfort. I'm going to listen to my body. And I might decide to set an intention for strengthening bone. Opening the eyes. Whenever you're ready, I'm just going to loosen up the neck a little bit, moving the head from side to side. So I want to share with you, the postures that have been proven to help with bone mineral density loss. But I also want to give you a holistic practice that leaves you feeling whole. So I'm not going to just do those poses only. We're going to be doing other poses, a few of them. Let's open the arms out to the sides. I'm going to push my chest forward, bring my arms back, and I'm arching that upper back. I'm squeezing my shoulder blades together. And this is helpful for undoing that rounded posture and getting things moving. So I'll bring the arms in front, interlace the fingers, and just pull the arms away from the body. So really all that's moving are my shoulder blades. They're sliding to the sides. Inhaling, opening wide, pushing the chest forward. Exhaling, interlace, pull the arms away. And we can take one more like that. Interlace the fingers, pull the arms away. And then I'll rest my hands in my lap. I'm going to lean forward with a flat back, right? So, yes, I have natural curves in my lumbar and in my cervical spine. I'm not forcing that to change. That's never going to change. And I'm leaning forward. I'm trying not to round my back and sink down. So I'm leaning forward with some strength in my back here. And then from here, I'll come up. So I just wanted you to experience what it means to lean forward with a flat back. For this next little movement sequence, I'm going to inhale my arms up. As I exhale, I bring my hands to heart center and place them in the lap and lean forward with a flat back. Breathing in, sitting upright, arms rise. Exhale, hands to heart center, bringing them into the lap, leaning forward. Breathing in, Breathing out. Let's take one more. And then I'm sitting up from here, and I'm going to interlace my fingers, press the palms away, juice up the fingers. Many of us caring for osteoarthritis in the fingers and the wrists, or issues with peripheral neuropathy. So taking a moment to kind of juice up my hands, my fingers, maybe doing some wrist circles, infinity sign, and shaking it out. All right, I'm going to grab on to the back of my chair, or the sides of my chair here. And just to show you from the sides, again, we're working on undoing the rounded posture. Grabbing onto my seat, lifting my heart, squeezing my shoulder blades together. And this is our chair version of a pose called Cobra. I'm going to pick up my chin just a little bit, unless you have cervical issues in your neck. And I'm going to try to find some easy breaths as I squeeze those shoulder blades together. And then I'll release, and I'll come to that forward movement with a nice flat back. And we can try that again. Grabbing onto the back of the seat, squeezing the shoulder blades together, lifting the heart. Maybe you can lift the chin if that would feel okay. Imagine you're a cobra rising up out of a basket, basking in the sun. And leaning forward, relaxing here a little bit. Very good. We'll come up to sit, and then I'll go ahead and take a little bit of a wider stance with my feet. Taking a wider stance, and I'm noticing my belly, and I'm noticing my lumbar curve here. And I'm just going to tilt the pelvis forward and back a few times. So the only thing moving is your pelvis. Try to do this slowly and gently, especially if you have any issues in your lower back. So this is just to kind of give us a little bit of warm up in the back. And then we can come back to a neutral posture, maybe rub the belly a few times for good measure. So good for digestion. Maybe you're caring for issues with digestion right now. This could be really useful. And then I'll take my hands into my lap and begin to stretch the sides of my body to prepare for one of our stronger bones poses. So I'm going to lift my right arm up and over and lean to the left. Keeping the foot anchored down and the sit bone anchored down. We're releasing back to center and switching sides. Left arm up and over while everything anchors down. And you can move from side to side at your own pace. You can take one more on each side. Really feeling that rib cage, all the little muscles in between the ribs stretching. And then let's come back to center and bring the arms out to the sides like a cactus. And once again, we're being asked to strengthen the upper back, the muscles along the length of the spine. So I'm going to squeeze my shoulder blades together, bring my elbows back, arch the back a little bit, and then we'll bring the forearms in front. See if you can get the forearms to press and the palms to press, a little bit of resistance. Inhale, open, lift the heart. Exhale, press, press, press. And we'll take one more. Open and press. Beautiful. And then I'll take my hands to my chair, and I'm just going to walk my feet in and out. Kind of juice up the hips a little bit here. You notice I'm not wearing shoes, but you can wear shoes for this. And especially if you're somebody who cares for peripheral neuropathy or diabetes, you might want to keep the shoes on. All right, stepping the feet back to center and stretching just the right leg out, pointing and flexing. maybe taking a circle. So I want to warm up all the joints in my body. Before getting into one of our bone strengthening poses. And we're going to try this pose seated. And if you'd like to try a standing version of it, you're welcome to do that, but I'm going to stay seated to show you. Right. So how I'm going to do this warrior two posture is I'm going to bring my right foot over to the right. And you'll notice that my knee is right over my ankle. And then from here, I'm going to stretch this left leg out in front with the heel on the earth, or I could sweep it to the side if that feels okay for me. That could feel like a lot on your hips, so you be the judge. I might be at the very edge of my seat. And then another option would be to try to put the whole sole of the foot on the earth and kind of rotate that hip in a little bit. So I'm zipping everything up. And this is where I'm adding the bone strengthening piece. I'm going to really hug my muscles along my bones here. So that's the warrior two lower body, and then here's the warrior two upper body. We've got mechanical leverage here where just by lifting the arms, I'm putting a little bit more pressure, a little bit more force on my shoulders, and that could help strengthen. And I'll shift my gaze over my right hand, and I want to stay in this, hugging the muscles along my bones in my legs and hips for 10 seconds. So I might take a couple breaths. Very good. Relax for a moment. We're going to stay in this foot shape, or if you need to walk it out, go ahead and do that. I'm going to come to this wide stance again, and I'm just going to bring my right forearm down on my right thigh. And immediately my body wants to crumble in. I want to really resist that and keep that twist to the left. I'm not going to put much weight in this hand, and then I'm going to lift my left arm up and over, if that would feel okay. You can always rest the hand on the hip if you have issues in this left shoulder. So you see my palm is facing my, I guess it's a left cheek, right? My left cheek. And this could be where you stay here, hugging the muscles along the bones, getting really long. And then we're going to come up from here and walk it out. So walking it out between sides. Opposite arm, opposite leg. See if you can really get things swinging and moving. Take a couple of big breaths. That was a lot on the hip. So let's try the other side. I'm going to bring my left leg over to the left. My knee is over my ankle. I'll bring my right leg straight out in front with the heel on the earth. I might be able to sweep that leg to the side a little bit. I want to stay upright, no rounding. Additionally, I might be able to bring my sole of the foot onto the earth and angle the foot in. I'm keeping my torso pointed towards you. Hugging all the muscles along the bones, and then floating the arms up, equally in both directions, turning the gaze over that left hand and holding my effort in my legs, squeezing those muscles, and then easing effort from my shoulders and from my jaw, finding some ease. All right, softening the arms down and maybe just relaxing for a moment here in the legs. We're going to stay in this open hip posture and move into our extended side angle. This is another one of the poses that was researched in Dr. Fishman's Yoga for Stronger Bones, or Yoga versus Osteoporosis study. That was a longitudinal study done and published in 2015. It took 10 years to do this, and it showed that doing these poses reversed bone loss. Now, we're doing a chair version. If you want to do an upright version, a standing version of this, you would be possibly, oh my God, that was too much talking. I hope you can cut this, Anne. All right, so we're relaxing a bit, and then we're going to come into extended side angle, another one of Dr. Fishman's studied poses. And we're doing a chair version of it. We're just going to hug those muscles along the bones again, like we did in Warrior Two. And we're going to bring this left forearm down. We're going to lean down, resist the urge to crumble, try to twist open to the right, and that right arm can come up and over. And I'm getting really long here. Still hugging the muscles along the bones, finding my breath. And releasing when I'm ready to release, walking it out. Opposite arm, opposite leg. All right, I'm already feeling so vital from just these few things we've done. Now you have an option to come to stand. Right? If you're feeling really fatigued today, maybe this is where you get off the train and you decide to take a 5-minute just snooze on the couch. Otherwise, you might feel like transitioning to a standing posture would be good for you today. So we can do some weight-bearing poses. So I'm going to transition slowly. I'm never ever in a hurry. I want to make sure my surroundings are clear. I'm not going to trip over anything. Got my hands in my lap. I'm creating some momentum, nose over knees, and I'm gazing where I want to go. I'm not gazing down. And I'll just come up nice and slow, walk it out a little bit, take a sip of water if you need it, anytime. And then we'll come into a standing mountain pose. So I've got my chair here, and I'm going to bring my feet about hips width distance apart, anchor down into the earth. Draw up some of that earth strength and energy. And we're going to practice moving the toes, lifting the toes, spreading the toes wide, digging them back down. Lifting, spreading, digging a few times. Could be helpful for those of us with peripheral neuropathy in the lower limbs to bring more awareness to this part of the body where we might have decreased sensation. From here, I'll invite you to come up onto your tiptoes and release down. Maybe you want to take one arm up. Maybe you're working towards both arms lifting. You could keep the hand on the chair the whole time, breathing in, breathing out. We're strengthening the calves, strengthening the ankles, the feet, putting a little bit of load into the ankle bones. All right. And maybe one more float up and float down. Beautiful. So I'm going to take the shape of my chair now with my feet hips distance apart. I'm going to sink down into my knees and bring my hips back. I want to be able to look down and see my toes. And I'm pushing my feet apart isometrically. And once I do that, I can really feel the muscles working in my glutes. And this is that muscular tension that we're putting on the bones. We're loading that force onto the bones, and hopefully new bone is forming as a result. So I'm going to tip my belly towards my spine, integrate there, and maybe mechanical leverage, bringing my arms out. Chin is level with the earth. I'm taking some breaths here. And then when I'm ready to come out of it, I'm walking it out. Beautiful. And then we can take a high lunge here. So I've got the right foot forward and the left foot back. I'm going to have all 10 toes pointing towards my chair, and I'm lifting my back leg, squeezing my left glute muscle, and just keeping my heart lifted, my torso upright. It's a good stretch, especially if you've been sitting for a while. I might stay here, or I might take one or both hands to the heart. Options. And then we'll go ahead and simply switch sides. Left foot forward, right foot back, all 10 toes pointing the same direction. Widen your stance for more stability. Try to find a stability here with your alignment. Squeezing the right glute muscle and bringing one or both hands to heart center, finding your breath. Beautiful. Now we're going to step back to a downward facing dog. Downward facing dog, unless you are caring for glaucoma or vertigo, you might take a peek down at the toes. And I'm lifting my kneecaps. So the backs of the legs are stretching and the fronts of the legs are strengthening. This is that dynamic tension we were talking about in our webinar. Come up nice and slow. All right. And then let's take a wider stance and maybe circle the hips a little bit. One direction and the other. And I might do a little more side bending, just getting ready for our next pose. All right. So let's come to bring this chair over onto my right side. I have a nice wide stance, not too wide. I'm going to move into a triangle pose now. So I'm going to bring my right toes to the right, and I'm going to angle my left toes in a lot. I'm going to let this hip travel with me. And this could be enough for me, right? I might be feeling enough. Or I might be able to lean towards my chair, and I'm keeping this left shoulder back, and this right arm might reach to the right. Excuse me, left arm might reach to the left. This might be as far as I want to go in my triangle, right? The other option would be to come down a little bit farther. Maybe you want to just take the hand onto the leg, keeping that left shoulder back. Maybe I can reach the seat of my chair here. Maybe that left arm comes up, and my gaze is going to be wherever feels safest for me and my neck. So if you're somebody who has neck issues and cranking the neck up might feel like too much, you could even gaze down. And I'm squeezing the muscles along the bones, and I've talked long enough for it to be bone strengthening by now. So let's come up out of it. All right, wide stance, circle the hips, release that. In between sides, I am going to do a little wide-legged forward fold. Right, so I might take my chair in front, bring a nice wide stance, and with a flat back, right? So flat back, I am going to, without rounding my back, I'm going to take a forward fold here. Maybe my forearms come to the top of the chair, right? Or maybe my hands come to the seat of the chair. Again, I'm strengthening the fronts of my legs while the backs of the legs stretch. I could tuck my chin and just take a few easy breaths here. Wide-legged forward fold. And then slowly making your way up. And we'll switch sides, triangle on the other side. So I've got that slightly wide stance, left toes to the left, angle the right foot in, the hip goes with you. And I've got my hand on my hip here. I'm just going to lean over to the left, and I'm trying to keep my right shoulder back rather than crumbling in. I'm just leaning forward and I'm squeezing those muscles along the bones. Right, this might be where you stay. You might want to reach the right arm up. Triangle is a very difficult pose, but it does great things for bone strengthening in the lumbar spine and in the hips. So I might be able to come down a little farther. I could put my hand on my leg. I could even angle that, I could sass out that right hip like a sassy teenager. Maybe the hand comes down onto the chair. Again, I'm resisting that urge to crumble forward. And I'm finding my breath. And that's quite enough time for some bone strengthening to happen. Come on up nice and slow. And let's just walk it out before we do our tree pose, a balance pose that is one of my favorite poses and one of the poses done in the study. So you can imagine a weight-bearing pose where you're only standing on one leg is going to put more force on that standing leg. So let's go ahead, and I'm going to start with the chair over here on my right side. I'm going to put the weight into my right foot. I'm going to pick up my left heel and open it to the side. I could pick up my leg and maybe the toe stays on the earth, or maybe it comes to the calf. And I might take my left hand to my heart. I'm squeezing the muscles along the bones and I'm zipping everything up. I have a soft bend in my right knee, and I might be working towards, just for a millisecond, bringing the hands to heart center. If I wobble out of it, that's okay. But I want to try to hold this long enough to get the bone strengthening impact. Low impact, of course, on the joints. And coming out of it, walking it out. And then we'll switch it up, bringing the weight into the left leg, soft bend. Pick up the right heel, open the leg to the side so we have that mechanical leverage, a little bit extra with the leg out to the side. This might be where you stay, or you might want to bring the foot up. I'm zipping everything up, hugging my muscles along my bones, adding that little extra for my bone strengthening. And I'm working towards taking my hands to heart center. Maybe it's just for a moment. Maybe I have to go back and forth. I can find a place to gaze that's far away and let myself relax a little bit here into my balanced posture. And then walking it out. I can really feel the good work we did in chair pose and tree pose. So I'm going to take one more downward facing dog before I come back down to sit. Again, lifting those kneecaps. Finding my breath, maybe at the back of my body. And then ever so slowly, carefully making my way up. Maybe taking that sip of water before you come to sit, making sure you have your strap, and coming to sit nice and slow. All right, so I've got my strap, and I'm at the edge of my chair here. I'm going to make a loop with my strap, step into the loop with my right foot, and just find a place where it feels best for you. I'm going to lift this right leg up. I'm going to hold a piece of the strap in each hand, and I'm sitting up tall here. So not only am I pulling the strap towards me, but I'm pushing the leg into the strap. So this is a pose, this is a version of the pose, big toe hold. And then from here, I'm going to take the strap into the right hand and gradually open that left leg to the right leg to the right. Maybe you feel comfortable bringing the left arm to the left. And we're hugging the muscle along the bone. And we're really working with that mechanical leverage here. So it's putting more pressure on that right hip. I feel like I should say yeehaw right here. And then coming back to center. Maybe you want to cross the midline just for a millisecond, little stretch there. And then I'm going to switch it up. So I'm stepping the left foot into my strap, picking that leg up. I'm sitting up tall. If you can't sit up tall and keep a tall spine here, you have to be in a rounded spine. Please come to sit at the back of your chair. So I'd rather you do that. So sitting up tall, pressing the foot into the strap, pulling the strap back. And then we're gonna take the strap into the left hand, open to the left. Doesn't have to go very far. Doesn't have to go as far as I'm going. Sitting up tall, hugging the muscle along the bone. finding a few easy breaths. And if your breath becomes ragged, you're working too hard. Ease up. Come on back to center, nice and slow, and cross the midline for a millisecond. And then release the strap down. So I'm going to roll up my strap, and as I roll up my strap, I'm going to see if I can notice how many breaths I take, how many breaths it takes for me to roll up my strap. All right, let's close out with 2 more poses. Just that right ankle coming over that left knee. Maybe you want to massage the foot for a moment. Massage can be really lovely for peripheral neuropathy, other foot issues. So I'm grabbing onto my shin, and I might already be feeling enough sensation here, or I could reach my heart forward with a flat back, letting the shoulders relax, tucking my chin, and taking a few breaths here. Coming up to sit, you can cross the knee over. And we're going to take a twist now, using all of our core muscles to do the work. I'm not going to force this, and it's a very gentle twist. I want to make sure that I'm staying really tall here. So I'm not rounding at all when I twist. I'm twisting to the right, and then I might rest my hands in a way that helps support my twist. Chin is level with the earth. As I breathe in, I'm getting taller. As I breathe out, I might twist a little bit deeper. Twists are safe for those with osteoporosis, osteopenia, if they are done properly and safely. Come on back to center. So we can take a very gentle twist, and as long as we are integrating our muscles around the spine and staying tall, we should be okay. Of course, you can check with your own wellness professionals just to make sure that that's true for you, because everybody is different. Just my little disclaimer. So I've got my left ankle over my right knee, and I'm massaging that left foot, thanking my foot for everything that it's done, carrying me through these many years. Grabbing onto my shin. I might already be feeling enough sensation here. I'm not going to force this, but I might be able to lean forward a little bit with a flat back, soften the shoulders. Take some easy breaths. And when you're ready to come out of it, sitting up tall, crossing the knee over. The knees are nestling, and we're taking that really integrated twist to the left. So using all those muscles in the core, along the back, and staying tall, staying lifted, using those hands to support and keeping the chin level. I'll take a couple breaths here. And this can be wonderful for drying out, for those dried out discs, right? Those desiccated discs, we can help irrigate. Come on back to center. And maybe you want to take one last stretch. Any other movements the body's asking for? Maybe you want to give yourself a hug for taking really good care of yourself today. And then we'll wind down with just 1 minute of rest and breathing. So I'm going to come to the back of my seat, and I want to allow myself to maybe relax a little bit here and relax the effort. I'm not slumped forward, but I'm relaxed. And I'm going to close my eyes, letting go of effort through my shoulders, through my fingertips. Letting the effort drain from my lower back, my hips, my knees, and feeling the imprint of my feet upon the earth. Letting my belly soften, breathing in, breathing out. Maybe I can draw up some nourishment from the earth. Imagine all of the elements of the earth that could help you be stronger, all of the minerals found in rocks, some of those really hard woods, imagining that strength in your bones. Can you take 3 more breaths in a row? And then we might just rub the hands together. Take off your glasses if you've been wearing them and cup the palms over the eyes. Roll the eyes around within the eye sockets. Could help with dry eye. And then we can bring the hands to heart center and close our session today with the sound of 1 Om and 3 Shantis for peace. You can just listen or join in. So I'm taking a breath in. Om Shanti, Shanti, Shanti. Thanking you so much for your practice today, my friends. Namaste. All right. It was so wonderful to see you practicing. We're going to open it up to some questions. If you have questions, you're going to type them into the chat. And I'm going to share my screen one last time for the final little piece of my PowerPoint that has to do with it. I'm sure somebody will have this question. So let's see if I can just share my screen one last time. How often should I do yoga? So you've got this great practice. We did a very gentle version of it. There is another video that has a getting down and up from the mat, and you might try that. And you could do that, I would say, 3 times a week. You could do a 30 to 60-minute asana practice 3 times a week, weaving in shorter practices so that you're doing a little something almost every day. Bearing in mind that yoga is more than just physical postures. So breathing, mindfulness, meditation, all of this counts as yoga. Bone strengthening, we want to be doing the asana portion. And this brings up the Yoga Sutra 1.14. Practice becomes firmly established when it has been cultivated uninterruptedly and with devotion over a long period of time. So I'm hoping that some of you will um, really dive into this and get your home practice going and come to our wellness classes. We do a lot of bone strengthening poses. And just to leave you, to remind you that it's the things that we do every day that have the most impact in our lives. Even if it's just one tree pose, right? That could really help with strengthening bone. We get a lot of side effects with our medications, but the side effects of yoga include better posture, improved balance, enhanced coordination, greater range of motion, higher strength, reduced levels of anxiety, thank God, goddess, better gait, and overall sense of well-being. And let's see, I see that we had a question. We had a question about a strap as well. What could I use as a strap? And, I really want to underline that when you're doing that big toe hold, whether you're seated or you're reclining, it shouldn't be a stretchy band because we want to be pushing into that strap and getting that resistance. So I'm afraid not. But you could even use a scarf. The scarf I'm wearing is not stretchy. So I could use a scarf, I could use a towel, could use a dog leash. So it's not the same as an exercise band. Um, so I appreciate you guys rolling with all of that. Are there the similar benefits from doing Pilates? Some of the similar benefits from doing Pilates. However, it depends if you need to go to a class and use the equipment. It's not quite the same because yoga, all I need is my mat and my strap, right? I don't need to go somewhere to do yoga. I can do yoga anywhere. I can do yoga in my hotel room in Seattle for the Ed Forum, which I plan on doing, and I hope to see some of you there. So the benefits of Pilates are slightly different in that way. They're the same in the way that it is an active thing that you are doing yourself. So that's a really good thing about Pilates. I don't practice Pilates, so I'm not really sure if there are a lot of weight-bearing poses, but I'm thinking there are that side lying balance where you're leg lifting. Those are really good things. So anytime you can just think about this for yourself, do some critical thinking. Would this be good for bone strengthening? Am I putting more pressure on the bone than gravity? And even just gravity is doing something. So thinking about that, and am I holding it long enough to receive the benefit? And am I enjoying it? So you might not enjoy yoga, but you could find something that you do enjoy that could bring you you could use the same principles. So thank you so much for that question, Carol, about Pilates. So let's see, we've got some other questions coming in. Any benefit to doing morning versus afternoon versus evening, asks James. Does it make a difference whether you do it approximately the same time every day? Oh, that's a great question. And I think just from an overall, yoga point of view, nothing necessarily to do with bone strengthening. I would say, if you're caring for fluctuating energy levels, this is an important factor. And does yoga energize you? So if you're somebody who's, kind of a morning person and you have your energy in the morning and you want to be doing a more vigorous yoga practice, then do it in the morning. So it's kind of depending on when you have your energy. And then, I could go into answering this question from an Ayurvedic perspective, that the time of day is important, but I'm not going to go there. We'll save that for another webinar. I'm hoping to bring Ayurveda into the cancer care continuum with our classes. Um, so James, I'm just going to say go with when you have the energy, and if you want, you can you know, um, do a more vigorous practice in the morning. You can do, if you didn't have time, you've got a doctor's appointment in the morning and you want to do an afternoon practice, you could do something a little bit easier. You could do the chair version. And then finally, if you want to do an evening practice, you could just take one or two of those poses from the gentle yoga video that will be available, that is a mat class where you're laying on your back doing the leg strap stretches. That's a wonderful thing to do before bed. So you can mix and match. And, I just have to finally, I'm just really babbling about the answer to this question, but here's all you really need to do. The best kind of yoga is the yoga you will do. That's what I want to say. There is no right kind of yoga. It's the kind that you will do. So it looks like several of you are coming to Seattle. I cannot wait to meet you. And we're going to be having a community yoga class on, I forget what it is now at this point, Saturday afternoon at 3:30, I think. So I think we're going to close this out, close the recording out. Thank you so much, and we'll see you soon, I hope.